Well, here we are with Dr. Gold, a ophthalmologist from Hamden, Connecticut. Hi, Dr. Gold. How is life over there?
Excellent. How are you today?
Good. Dr. Gold, let me ask you something. You're an ophthalmologist, and you have a practice. You know, ophthalmologists do lots of things. In fact, lots of people out there have a little bit of a confusion. What does an ophthalmologist, an optometrist, and even an optician do? I mean, not that everybody has a confusion. Many people do know it. But either way, different doctors do different things. Give us a little bit if you don't mind, a philosophy of your practice. Like, what is your philosophy about eyesight which you pursue in your practice? And frankly, Dr. Gold, if you don't mind telling us, what made you becoming an ophthalmologist? What brought you into that type of business? Lots of people I talk to have quite a story connected to it. But whatever it is, I would appreciate if you tell us.
Well, when I was 5 years old, I got my first eyeglasses. And it was at that time that I discovered that trees actually have leaves. And anybody out there who's nearsighted can relate to that statement. People who just need reading glasses like yourself never really had a problem with their distance vision. But people who were nearsighted or are nearsighted without their glasses or contact lenses really can't perceive distinct distant objects. So I got my first glasses when I was 5 years old. I discovered that trees have leaves, and I was intrigued by the things that were done to me at that first eye exam. Then when I reached medical school a number of years later, the first course that really got me excited was the course in ophthalmology. And I decided at that point to investigate it further. I did that through our teacher, through the residency program at the University of Tennessee Medical School where I was. And I found I really enjoyed ophthalmology, and I was able to use the gifts that I was given as a surgeon to help people regain the vision that they either never had or that they had lost for one reason. So I became an ophthalmologist about 35 years ago.
I see. Wow. So you planned to become, to go into the medical field, so that kind of apparently was part of your DNA when you were young, and you went into the medical field, but then as in the medical field training you went through and you started learning about the eyes, that in specifically very interested you, and so you became an ophthalmologist.
Exactly.
Wonderful. Now, tell us a little bit about your practice, the patients who come to you. What do you tell them? How do you treat them? What do you pay attention to? Kind of what's your philosophy in your practice? Because I'm very sure that, different doctors in every field still have a slightly different philosophy, and it's good for patients to know, what they can expect.
Well, let's go back a little bit to your earlier question about the differences between opticians, optometrists, and ophthalmologists. The simplest is opticians, and what they do is they make eyeglasses for people. The next level of training up is optometry, and they are trained to examine eyes and in some places around the country to actually treat some eye disease. And then there are ophthalmologists who are MDs, gone to medical school, done an internship and then surgical residency to learn to treat everything about the eye, both with medicine and with surgery. That's what I am, an ophthalmologist, and I am skilled to treat all sorts of eye disease, diagnose and treat all sorts of eye disease. As I went through my career, I found that the thing that intrigued me the most was refractive surgery, which started in the early 90s, generally in this country, with radiokeratotomy, which was a procedure that was performed changing the shape of the cornea with a diamond scalpel. And that became supplanted when lasers were developed that could change the shape of the front surface of the eye in order to change where the light rays focus inside the eye, thereby eliminating the need for glasses. So the lasers were approved by the FDA in 1995 to be used for vision correction surgery in otherwise healthy eyes. And I was involved in the second laser center in the country to do that when I was practicing out in Salt Lake City. And I learned how to do a procedure called PRK, which is phototherapeutic keratectomy. which involves no cutting whatever of the eye in order to change its vision. Within about 2 years after that, there was a development of a procedure in which the cornea was cut, and it was called LASIK, laser-assisted in situ keratomelusis, in which the cornea was cut, the flap was folded back, and the laser then changed the shape of the third layer in the cornea in order to affect where the light rays focused on the retina. And the flap keeps sealed back in place overnight. But it turns out there was a study released earlier this year, in 2011, that indicates that that flap never completely healed. So LASIK patients can be subject, if they get hit in the eye just the wrong way, for the rest of their lives, for the flap to become loosened. And if that happens, they're in big trouble, potentially.
I can see.
About 4 years ago, an update of the PRK procedure that could be done with a mechanical device just to take off the first layer of the cornea with no cutting, and then change the shape of the second layer. That procedure is a modern version of PRK, and there's no cutting involved, which makes it a much safer procedure. There are a number of doctors around the country, including myself now, who will no longer do LASIK because of the safety factor, and limit themselves to this new version of PRK, which is called epi-LASIK, because all we take off is the epithelium. And it's a procedure which can produce higher quality vision than LASIK. It does take a little bit longer for the vision to reach that quality, so there's a 3-day recovery period as opposed to just overnight. But during that 3 days, activities are not restricted at all. The eyes are covered with a special contact lens that allows the epithelium to grow back smoothly, which is the key to recovery of that procedure. And there is less dry eye produced. There's certainly more safety because there's no cutting. Better quality of vision, because all we have to do is to get the epithelium to feel smooth. That's a piece of cake with the contact lenses. And there's less loss of tissue, because when we take away the tissue with the laser, the second layer down, there is less tissue removal than in the third layer down. So I have come exclusively to doing epi-LASIK over the last several months, probably since the beginning of 2011. My results are better, patients are happier, and they're clearly safer.
So basically, patients who need LASIK are the type of people you see, and you really don't now, fix anything else. But what about people who come in and they don't necessarily know they need LASIK because it's your examination or an ophthalmologist's examinations which will determine that? So can people come in, you examine them, and if they need LASIK, you do it, and if they don't, then they go somewhere else? How does that work?
For sure. I do general eye exams just like every other ophthalmologist does. And if I find a patient, for example, with glaucoma or with cataracts, I have a network of colleagues that I can refer these people to. And if they come from me as a referral, they get in much more quickly than if they just call somebody else who has a higher volume of practice than mine.
Right. And so what about a person comes in with an examination and he really doesn't need any type of surgery as such, but he might need glasses, he might need lenses, whether it's far sight, near sight, reading, whatever it might be, might need other type of stuff. How will that get fixed in your practice, Dr. Gold?
Well, I still prescribe glasses for people who need glasses and don't want surgery. And simple contact lens fittings I still do. If the contact lens fitting is complicated by astigmatism, then I have one particular friend that I refer those patients to. He's an expert in fitting astigmatic contact lenses.
So what I really see and hear from you here is that you seem to have a belief that you say, look, the health and the eye, of course, very, 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 very important. While we don't want to lose a little toe and a little finger, but losing an eye is just a little more severe. So in any case, it is worth it to go and get it fixed by a guy that's what he does. Rather than try to be, even though an eye is a relatively small part of our whole body, there are several glaucoma and cataracts and the LASIK and the other things, and what you want to do is really get the patient to a guy who is super good at what that patient needs. That seems to be a belief of yours from what I hear here. Am I right here or wrong?
No, you're absolutely correct. I think that in order to be really good at doing what you do, you should do a lot of it.
Right.
If you don't do a lot of that particular procedure, you're probably not as good as the next guy who does a lot.
Right.
And I strongly feel that patients should be taken care of by the person who's the best at what he does.
Right.
And I strongly believe that I'm the best LASIK surgeon there is in the state because that's all I do.
Got it. I got it. So, despite the fact, you see, the whole world to a certain degree is talking about all under one house, all under one roof. And while that has definitely some advantages sometimes, because, patients, be it a dentist or whatever, they don't want to go to 6 specialists or to 6 other doctors doing it if they don't have to. But as I said, it has some advantages. But, we're talking the eyes here. We're talking something very, very specific. That little hassle of having to get your butt to another person's office if needed is what you say is well worth it, because you're dealing with something, if it is messed up, it ruins your life.
I think that's correct. And even in the large group practices where there are a number of ophthalmologists, one specializing in LASIK, another specializing in retina, another specializing in glaucoma, what happens is if you see one of the general ophthalmologists, and they find a problem of cataracts, for example,
right.
And what has to happen is you have to make another appointment to come back on a different day to see the cataract specialist. So even though it's in the same building, it's not all at the same time.
Mm-hmm. So obviously there's a purpose behind specialization, and I can see why. You don't want to get your whatever it is. You don't want to get your stomach taken out by a hairdresser, and you don't want to have a surgeon who replaces hips fixing your flat screen TV, I guess. It's maybe a little far-fetched, but something in that neighborhood, I suppose, right?
Those are good analogies.
Okay. Well, Dr. Gold, thank you very much for explaining us what you're all about. It's wonderful to see somebody who obviously, when you made the decision to go into the eye field, doesn't look like you have regretted it, simply because you're still enthusiastic about it, still learning, still specializing, and that's wonderful. Thank you very much.
Thank you.